A case of cervical spondylitis. A middle-aged lady who has been under my treatment for last more than a year for obesity and chronic fatigue syndrome and liver disorders, etc. What happened is all of a sudden, while watching movie in a theatre few days back, she developed a severe pain in the right side of the neck, that is the nape of the neck. And next day when she comes here, I found it is all stiff, and my diagnosis was cervical spondylitis. So the routine prescription I give for cervical spondylitis is acid phos. So this medicine was given, but unfortunately that medicine did not work. It was very severe, so patient went to an orthopedic doctor. Orthopedic doctor very well diagnosed the same cervical spondylitis, given some painkillers and advised certain exercises of neck and head, etc. So this second doctor, what he did is, along with this treatment, he recommended the patient to go to another ENT specialist. Said that it can be a cause of sinus infection also. Here we should remember that what is a sinus headache? Sinus headache usually happens in the frontal part of the head or face. Sinuses are the empty spaces present in our skull, particularly behind the eyes, in between the eyebrows, around the nose and back of the nose and in the cheekbones. So this central part, you can say, is the area of sinus. When you have heaviness, pain, dull ache, all that in this area, then you can suspect of sinus. But here the patient absolutely has nothing here. She has the pain here in the nape of the neck. Still, as per the advice of the orthopedic doctor, the patient went to an ENT specialist. Now the ENT specialist has carried all the investigations like X-ray of the skull, then audiometry, etc., etc. But all the reports came normal. Now the ENT specialist says, this all has come normal, you should go to a neurologist. So the fourth doctor is recommended now. Fourth one is neurologist. So now the patient is quite intelligent to understand that the way of her treatment going on. So instead of turning up to the fourth doctor of neurologist, she again turned back to me, the first doctor. So after roaming around so many doctors, when she comes back to me, now the accountability of my work becomes more. So I had to rework on her case. Now what way I proceed? Since for last 1 year she is known to me, it was easy for me to apply the sensation method of Dr. Rajan Sarkaran for this case. First is to which kingdom she belongs to, plant kingdom, animal kingdom or mineral kingdom. What is the ailment, problem? Problem is the pain, the suffering. It is neither the breaking of structure or organizational failure of mineral kingdom, nor the aggressive or the victim, that concept of animal. So the main concept is here the pain, the suffering. So clearly plant kingdom. Under plant kingdom, which family I should put her? Since I know her for a year, I know about her the details of the constitution. She is a quite qualified lady and used to have a dream of her own career, standing by her own self. But due to the family requirement, she has compromised with her dreams. Like she is an engineering graduate, but still she did not go in that lane. and now she is totally a housewife. Despite of these limitations, even then in between she tries to come above this. For example, she goes to join a Zumba class, she goes to take some fitness training from fitness trainer in between, but she cannot continue it for a long time. Again she comes back to the same status. Similarly, she has undergone a Montessori training and started joining a play school as a teacher, and taken some extra tutorial education for the students. So at home also, evening hours, she started giving those tutorial classes to the school students, and she used to enjoy those things whenever she is being occupied in all these activities. But after a few days, again the family pressure came, and she was not able to cope up with all these work schedules, so she has to cut off the school activity, she has to resign from the job. So she took effort, but again she came back. Now this thing comes as the theme of contraction and expansion. Contraction and expansion. This theme of contraction and expansion I have found out in several spheres of this case. Number one, I explained the academic and the career opportunity. Number two, when she has anxiety, how does she react? She gets breathlessness. She feels the respiratory apparatus has got squeezed. There is shortness of breath. There is not enough space to breathe in and breathe out. There is a hankering for breath. This is again contraction and expansion. When the gastric problem happens, she finds the gas is got trapped in the chest, and there is a difficult suffocation feeling in the chest. There also she is having the same shortness of the breath. There also she feels it's all congested. Just something should get me released. Again the contraction and expansion. Now if you see the muscles of the back in the spondylitis, what is happening? Stiffness, contraction. And when you give medicine, that should get released. So in several spheres, when we note the same phenomena, same theme is taking place, contraction and expansion, then that becomes the generalized pattern of the case. Coming to the plant kingdom, we have the family Cactaceae. Cactaceae family has got the theme of contraction and expansion. Now under this, which miasm she belongs to? She already has got obesity, etc., which has put her into psychotic miasm, but it is not the mere psychotic miasm in her. What happens? She gets exacerbation of the mental anxiety in between. For example, if the neighbor is shifting the house, she will get anxious. How I will live, they are all going, then how somebody else will come, how I will cope up. And that goes on reeling in the mind. If she hears any news of robbery happened in somewhere nearby houses, then couple of nights becomes sleepless for her. So these are the acute exacerbations of the anxiety. This calls for the miasm of malaria, malarial miasm. Now the psychotic miasm plus malarial miasm together, when the psychotic miasm and the acute miasm together when we club, it comes to malarial miasm. Now in the plant kingdom, Cactaceae family, we have malarial miasm. There is only one remedy called cactus grandiflorus. Before prescribing this remedy, I want to just cross-refer it in Materia Medica. Lotus Materia Medica nicely explains under many headings of cactus grandiflorus. In the italics bold, it is written that constriction and expansion. If there is gastroenteritis, cactus patient will say that stomach is contracting and expanding. When it contracts, I get a lot of pain. When it expands, I feel good. In the lungs, there is a difficult breathing, suffocation, as if the lungs are being contracted. Chest is being congested, chest is being hidebound. And if it is released, then I feel good. In the throat, there is a choking sensation, suffocation, and when that is gone, I feel it is relieved. Now if you see the cactus plant, what do you see? Internally it is so soft, the spongy like structure in the cactus leaves. But externally, how thick is the skin? It's so thick that even you find sometimes in the cactus plant there will be many thorns. In order to avoid the water evaporation, the leaves, they grow thorns in between them. So hard. Internally so soft, externally so hard. Many times we see the cactus patient also have the same character. Internally very sensitive, very sentimental, but externally they refuse to express those emotions. It is all neutral expression outside. You can see such patients having clear thickness of the hand skins, developing thorn-like warts. So this all confirms the remedy of cactus grandiflorus. We prescribed the remedy cactus grandiflorus, and in 15 days later when we see the spondylitis pain which was so severe, now it has come down to 60%, and the first day of prescription of cactus grandiflorus itself, we have completely stopped the other allopathic medication. The cactus works.